My name is Ria Earp. I'm currently the Māori advisor for Hospice New Zealand. I've retired last year from Mary Potter Hospice, where I was the chief executive for 11 years. And prior to that, I had been a senior member of the Ministry of Health with an oversight on Māori health and Māori initiatives and Māori health issues. Well, I think firstly, hospices traditionally weren't places that Māori saw as an appropriate place for them to go to or to be part of a hospice service. The other thing that happens and is really ensuring that there is cultural safety in the way in which the services are delivered. One of the big challenges for staff at the hospice I worked at initially was large families coming in, and for somebody who is taking some time inside the inpatient unit, having a very large family suddenly appear and not really understanding and having a different perception of what kind of interaction they wanted with their family member while they were inside the hospice was a key issue. I know that in my mother's generation and my grandmother's generation, hospital per se was a place that terrified them, terrified the family, because if you went into hospital you usually did come back in a coffin. Things are changing amongst Pākehā community as well, and I think Māori have influenced that quite considerably. So I'll come back to that question in just a moment, but if you think about one of the most striking differences is the bringing together a family around that person and the view of not dying alone, the view of the need for spiritual care. Even if somebody hasn't been particularly religious or particularly concerned about spiritual issues, at the end of life that becomes more important, and it is seen as a time when the potential to meet with your ancestors is there. One of the things that I have noticed a real difference for Pākehā that I think have been influenced by Māori is participation of children. So you are more likely to see children turning up to the hospice, and you're more likely to see children, of course, involved in funeral services after somebody has died. So there is a view about expanding the experience to a wider group rather than necessarily hiding things away, which was the sense that you quite often got for families and much of that was as much about not having experienced somebody dying near them. So that I was always surprised by my Pākehā friends who were really in their 50s or so, 40s, 50s, 60s, when the first time they experienced someone close to them, in their family close, even a grandparent, dying. I was a young child when I first went to the tangi of my uncle. I can recall very distinctly the tangi of my grandmother. I was around 12 around that time. And we were expected to participate. We were expected to either support the back of the house with setting the table, for example, for visitors that were coming. We were expected to stay and sleep next to my grandmother, who was in her coffin, and that was that was not a scary experience, although I think there was a lot of taking care of the children as well, so making sure that it wasn't a scary experience. I knew that my grandmother had died, and one of the things that staying actually on them, what I meant was hearing stories. Loss is another key area. So it is grief and loss is more accepted. It's seen as part and parcel of the process, both of dying and of post death, and how that is managed, how grief and loss is managed amongst together and with others and support of others is a significant way in which I think Māori have begun to influence pāhia practice. I see it in the sense of the way in which funeral services are being held. I see it in the way in which families are getting together to grieve. Quite often it's a lot more common these days for a pāhia family, for example, to take the coffin home and lay that out in the living room. It may be just one night, but prior to the funeral. So I've seen that occurring. Well, I think there's going to be an awful lot of debate around this. I think, and just as you have diversity of views in pāhia community, you also have diversity of views in Māori communities. One of the things that in the discussions that I have held anecdotally is the issue about how that decision gets made. It's very much based on an individual choice, and that's often the argument. It's about I should have the choice as an individual. It's a key aspect that I should determine because I'm the one who is dying. From a Māori point of view, it's actually around how you involve others who care, what's the kind of impact that death is going to have on that wider family, wider carers, people who are involved with you, and the way in which that legislation is being considered means that there isn't any space for family to be involved in that discussion, because that's a cultural point of view as the individual. Rather than the collective view of how you collectively manage what is really a natural process of life.